Ladies and gentlemen, welcome to ITB. This is your host, Dr. Yavuz Selim Sılay, physician, entrepreneur, and venture architect. I promised you that I'll bring people from all walks of life who are role models for our society. Today, I have an amazing guest of mine who is one of the best surgeons in Turkey, a great friend of mine from my hometown, Iskenderun, which I actually studied high school together, Professor Dr. Ali Khan Gökakın. He is with us today. He is an amazing surgeon and working in a very important chain hospital, Medicana International Hospital, and he's also a faculty at Atılım University, which is one of the most prominent and young, fast-growing university in Turkey. So today we will talk with him about who Ali Khan Gökakın is and what his vision is and what he is doing. Ali Khan, welcome to ITV, welcome to NTR. Thank you so much.
Thank you so much too. It's a great honor and privilege for me to be here with you. Thank you for your invitation. Also, hello to our viewers.
Thank you, thank you. Ali Khan, we know you very well. You are one of the most renowned surgeons in Turkey. What you have done is amazing. You have many patients which are always praying to you, welcoming you with your achievements in obesity, your achievements in actually liver transplant, and your achievements in hepatobiliary surgery. But for our viewers, from very beginning, can you tell who Professor Dr. Ali Khan Gökakın is?
Well, let me summarize a little bit. As you said before, I'm a medical doctor, particularly a surgeon, since 2000.
Almost 20 years now.
Almost 20 years I can be accepted as surgeon. I worked lots of universities in Turkey, in every part, especially in the eastern part and in the Asian part of Turkey. For last 2 years I'm in Ankara. I became a professor at general surgery 2 months ago. I can be accepted as a young surgeon, maybe the latest one.
Also very handsome.
Yeah, thank you for your great compliments. I also have to confess that it's a great honor for me to be with you, with my old friends since more than 30 years. Thank you for your invitation again.
Thank you for accepting. Thank you.
Being a surgeon was my dream, as you know, from the high school.
I do remember, yes.
So it came true. Thank you for God to make me to have an opportunity to help people being a surgeon as a surgeon.
Excellent.
I'm very glad to be in here, in that position, in the center of Turkey, in the capital city of Turkey, in a big chain hospital, in a university hospital. To work as a surgeon, to work as a hepatobiliary surgeon is a great opportunity for me.
It's huge. But they are also lucky to have you, Ali Khan.
Thank you.
We know that your effort from the high school years, I remember you were an A student, very idealistic, always looking for the goodness of people and do the good things as an idealist person, help and give. So I'm so happy that you achieved this. But I want our viewers to get to know you more. Like, how did you become a physician? What was your motivation? How did you end up being a surgeon? I know you have been inspired since your high school years in Iskenderun Anatolian High School. But can you tell where you graduated from university and your story a little bit more?
Yeah. After the high school, in Turkey, you have to attend an examination for university education. I attended to Gazi University. In there, it takes 6 years
Yes.
For medical education, and then an examination more for your residency. I trained at Atatürk Training Hospital as a general surgery residency. It takes about 5 years. So in 11 years old, you take your profession. In 2007, I become a general surgeon. And then I choose my direction to hepatobiliary surgery to go on in that position. So I worked in 2 different university hospitals, in Sivas Cumhuriyet University and Denizli Pamukkale University. And then I went 2 great centers in Turkey, in Istanbul, in Malatya to become a hepatobiliary surgeon and liver transplant surgeon. Worked more than 2 years in both of them. So it took almost 20 years to become a surgeon.
That's amazing. It's a long run,
Yeah, in medicine, particularly in surgery, it's not only a profession, it's a lifestyle, maybe a patient. So I always followed my patient to be a surgeon, a hepatobiliary surgeon, and we will go on to help people because our first motivation is to help people, to help people who needs.
Absolutely. And I know from your high school years, you are very passionate about helping people. And I'm so glad and so honored that you're at this stage now. And it's also a huge opportunity for our viewers because I know Medicana is one of the most important international chains. There are 4 large chain hospitals in Turkey. It's one of them. And they are very strong and they are also growing with new hospitals all across Turkey. And from your vision, do you have patients from Africa? And how do you see the current healthcare relationship and healthcare tourism opportunities between Turkey, Africa, and the rest of the world?
Well, as you know, Turkey is at more than 20 years' time. Turkey changed lots of things about healthcare system. We began to look patients from other countries about 20 years. In our chain, Medicana hospital system, we have more than 14 hospitals in all around Turkey, especially in big cities, Istanbul, Izmir, Ankara, Bursa, Samsun, Sivas. All of these hospitals are accepting patients from other countries, foreign countries. Especially in Ankara, we have a department who cares with the people from our countries. We have also patients from Africa, especially from Sudan, Libya, Somalia, from Middle East, Iraq. Iraqi people prefers us. We have an other department who can speak their language, their own language. Our hospital welcome from after their arrival to Turkey till their departure to our country, their country.
So it's like a VIP service.
Yes.
You're Somalian, you only know Somalian language. You fly in from the time you just land.
Yes,
you
we welcome you.
VIP, and then with all the language and opportunities, then they're taken care of. That's amazing.
Not only for Africa, also for Middle East, for ex-Russian countries, for Balkan countries, we all serve to them.
Amazing.
In every branches, not only for general surgery, all of them, especially our brain surgery and cardiovascular surgery is very popular among the people. Our oncology service is very popular in that area.
Cancer is also a big problem. We have many patients. We receive lots of WhatsApp messages that are demanding for services. So we will definitely make sure, please call through these numbers right now. And if you have any kind of medical situations, we'll be honored to connect it to Medicana and especially to Professor Dr. Alikan Gökakan. Remember, he is an expert in obesity. He's an expert in liver transplant. There are patients which need transplant and hepatobiliary surgery, but he is in general a surgeon, very skillful surgeon. If you have any questions, feel free to send through these WhatsApp messages right now, and we'll connect you with Professor Dr. Alikan Gökakan at Medicana International Hospital.
We are here to help you.
Thank you. Thank you,
for your great confidence.
So my next question is, in terms of the patients when they come here, what was the outcome? You as a patient yourself, you were before close to 117 kilogram, and you dropped about close to 40 kilogram. And you are yourself a role model to begin with.
Thank you.
Then you show other patients, maybe people don't believe. But if you start with yourself, if you don't mind. I know it's private, but also take it, the patients that you have, and what were their outcome? Like if you can give some examples of your own patient in different situations that you can share with our viewers?
Well, in terms of obesity, it has some strict indications.
Sure.
If a patient has a BMI index more than 40, it's useless to go on with dietary or with exercises.
So if you have a body mass index more than 40,
you
then it is not
you
easy
need
to-
an intervention.
I see.
You need an intervention then, because when you exceed the 40 BMI, it also causes collateral damage like diabetes mellitus, hypertension. It lowers the quality of life. It will be bad for your sleep also. So we propose them an intervention.
I see.
That depends on the need of the patient. Every patient needs
Definitely.
different interventions. Some of them needs directly to surgery, but before the surgery we can try our medications, other medications. But most of them, if BMI is over than 40, it generally requires an intervention,
I see.
a surgical procedure. At the moment in our hospital we have a obesity center with a team which consists of surgeons, dietitians, psychologists, internal endocrinologists. We evaluate the patient in a multidisciplinary approach.
Excellent.
We decide case by case to approach the people. We help them and we make them suggestions. After the treatment, we also go to follow them about 2 years more.
Excellent.
So we don't do that. We operated you, go to we don't say that. We
The
go
follow-up
on.
is very
Follow-up is very important
I see.
because these patients requires more intention. So we are here to help them
Excellent.
with a great team, not only for obesity, also for cancer patients, also for transplantation patients. We have a great team in also kidney transplantation at
Great.
Atıl University, one of the most high volume center in Turkey.
Very high experience.
Yeah,
and
very high.
quality
We
work.
have a high experienced team also in
Excellent.
kidney transplantation.
important.
Maybe you can talk with our other surgeons in
We'll be
kidney
honored.
transplantation.
We'll be
Also, he's from Ankara University, your
Excellent.
university.
Excellent.
Also, I would like to say that in our hospital we have a great team in cardiovascular surgery and brain surgery. So we are waiting our patients from all over the world, especially from Africa.
Excellent.
We have 4 or 5 people, African people, working with us at the moment. I think one of them from Sudan and one of them from Somalia. They are also
Excellent.
doctors
Excellent.
who graduated our universities in Turkey. They know Turkish also. They taught their languages.
Amazing. So there is no cultural barrier.
No.
A patient who will come anywhere from the world, they will feel welcome at home with
Yes.
your expertise. This is amazing. And the examples you gave me is very impressive, in terms of obesity, in terms of transplant, both liver and kidney,
Yeah.
and also hepatobiliary surgery. You have a great experience for sure. And I want to find out more about, do you see more and more during the COVID-19, what are the challenges? And do you see, Turkey opened up for healthcare tourism in May 26 and invited, if you be tested COVID-19, then you can come here
Yes.
for your medical, whether you need a hair transplant, whether you need an in vitro fertilization or a cancer surgery. Turkey has opened up, but some countries in Africa, they are not letting to get out. That's the other challenge. But Turkey is in a way is wide open for anyone who wants to get medical treatment. With COVID-19, with the new normal, how do you see things will continue? Like they say maybe for the next 2 years, COVID-19 will continue. So that's why we need to embrace it and work with it. But did your work style, how did it change, and did the flow of patients went up, down? How is it changing right now?
Well, as you know, this is a global pandemic, so it affected us too. As every hospital, as every country,
Sure.
we affected. The number of the patients coming from the other countries down in that time. But by the time people begin to learn to live with this disease, this pandemic, for our hospital, every patient from other countries or local patients, we provide tests for COVID-19, especially PCR tests before the surgery. It takes about 10 or 8 hours to take the result. If the result is negative, we go on to make our other treatments and tests. So before any operation, any interventive procedures, we make the test, we take the result, and then go on to treat him. So especially patients from the other countries, foreign countries, when they arrive to Turkey, they make their PCR tests. After the result appeared negatively, we go on to treat him. So, you know, there's always a risk, but we are trying to minimize it. Excellent. And I think we can be accepted as a successful hospital to deal with COVID-19.
That's very important. That's very important.
We don't accept the COVID positive patients in our hospital at the moment.
Sure. There are pandemic hospitals. Yeah. That's the system.
There's a system in Turkey. Yes. Pandemic hospitals accept them, treat them. If it requires to hospitalize patients, they can hospitalize them. Maybe sometimes they can treat in outpatient model. But at the moment in Ankara Medicana International Hospital, we didn't see any sign of pandemic.
Excellent. I had a friend of mine internationally. He had to go. His mom passed away. Yeah, his friend is Zahid Aslam. He said, Yavuz, I need to go tomorrow. I have a flight. So I called my friend at Medicana. They rushed him and they were able to do the test, and he was able to reach his flight. Yeah. They even pulled early his testing result. And
in emergency conditions, we can
he was negative, and then he was able to
provide results in 6 hours, maybe 8 hours in emergency. So our hospital can provide that service too.
That's amazing. But if someone is tested positive, you don't accept that patient. You send it to pandemic patient, pandemic hospitals.
If he or she requires hospitalization, if he doesn't need anything, only a follow-up or an outpatient style, we continue to treat them. We make our suggestions. For isolation or medical treatment, we can advise them. We have healthcare providers to help them. But as an hospitalized patient, they have to go to pandemic hospitals.
Perfect. Thank you so much, Ali Khan. Ladies and gentlemen, we will give you a quick commercial break. Stay tuned to ITV with my great friend Ali Khan Gökakın, who is an amazing professor. And we'll be right back. Stay tuned to ITV. Take care and all the best.
Being symbol of expertise, modernity, quality, and international standards, Medicana Health Group is among leaders of Turkish private hospital business, and it has been providing healthcare services for 20 years since 1992. Medicana Health Group offers healthcare services in accordance with corporate vision, including compatibility with international standards, modern closely monitoring innovation, regarded as model facility by other healthcare institutions, offering highest quality and equal services to both local and international patients, a healthcare facility where patients feel safe and all expectations are met, as well as corporate mission, including offering highest quality healthcare service to all patients from all social layers, continuous development of personnel and enabling personnel to work happily and under safe conditions. Reaching international standards in short time, Medicana Health Group was accredited by Joint Commission International. and accordingly it was registered that our institution is the healthcare facility which complies with standards of European Union and maximizes patient satisfaction. Since 2006, the group gained first rank among healthcare facilities, which makes highest investments, and number of hospital under umbrella of the group reached 10, when Medicana International Istanbul, Medicana International Ankara, Medicana Samsun, and Medicana Konya hospitals are put into service. Based on hospital investments regarded among unique hospitals worldwide, we feel the happiness to offer international quality healthcare service in terms of specialism and equipment requiring qualification, such as oncology, adult and pediatric cardiology, cardiovascular surgery, transplantation, hemodialysis, gynecology and obstetrics, and pediatrics and in vitro fertilization. All Medicana hospitals are clearly characterized with healthcare facilities where all patients feel themselves safe, all necessary healthcare requirements are met, and uninterrupted and top-quality healthcare services are accessed, and healthcare professionals want to work. In addition to oncology, transplantation, cardiology and cardiovascular surgery, aesthetic surgery, orthopedics and traumatology, ophthalmology and oral and dental health and care, and neurology, neurosurgery, pediatrics, and many other services, healthcare services are also offered in multidisciplinary clinics in order to respond to gradually increasing and complicating healthcare needs. And thus, Medicana Health Group continues to make great efforts in order to maintain smile on your face and to deserve a pair of good words mentioned by our patients and close connection with our patients, of which we wish to survive lifelong. We wish you a healthy, quality and good life. Medicana.
Ladies and gentlemen, welcome back to ITB. Today I have an amazing top surgeon who is doing an amazing job at Medicana International Hospital, Atılım University, Professor Dr. Ali Khan Gökakın. He is with us today. Dear Ali, I am really impressed with what you explained in the first part. I want to get deeper into the medical areas. You know, you mentioned hepatobiliary surgery. For our viewers, can you tell what hepatobiliary means to begin with?
Hepatobiliary system is a part of our digestive system, as you know. Particularly, we are interested in the disease of hepatobiliary tree, pancreatic system, liver, and the biliary tree.
So we have pancreas, liver, and the biliary duct or biliary tree.
Biliary tree and the gallbladder.
And gallbladder.
And gallbladder. Not only benign disease, but also the malignant disease are in our interest, not only for surgical procedures, but also the medical treatment of them are in our scope.
Excellent.
From liver to pancreas.
Okay.
Especially the biliary tree is in our scope. Not only the malignant disease or cancer patients, but also the benign disease. You know, there are lots of benign disease in our biliary tree, beginning from the gallbladder to common bile duct, to pancreas. All of the disease are in our scope. Most of the patients are referred to us. As a matter of fact, we are not interested, we are not working to make diagnosis to patients. Most of the patients are coming from gastroenterology to us without diagnosis in their hand. Gastroenterologist sees the patients and make the diagnosis. For instance, they say this gentleman or this lady has cholelithiasis or common bile duct stones or pancreatitis or pancreatic cancer or duodenal cancer or liver cancer. They take their diagnosis in gastroenterology unit. They are they refer the patients to us. If they require surgery, we examine the patient, we make the test, and we decide together with our team, we treat the patients. Hepatobiliary surgery or hepatobiliary medicine is one of the greatest challenging part of the surgery. The procedures are very complex. It takes very much time to operate them. Also, it requires a multidisciplinary approach. Not only it's not a one-man show.
Sure.
It's
a huge team. Yeah.
It's you need a huge team. Maybe I make the operations, but there are lots of people helping me, from beginning of the nurses to the other internal medicine doctors, gastroenterologists, radiologists, anesthesia. We have a great team. You have to have these branches to help people in hepatobiliary disease.
That's amazing. It takes like a village to grow a child, they say.
Yeah.
For this surgery
Just like
as well.
just
it takes
like
almost a
that.
village to do a surgery.
Just like
That's amazing.
just like especially in pancreatic surgery in malign forms, also in biliary tree malign disease requires a multidisciplinary approach. You have to have a great team. Thank you God, we have a good team in
Excellent.
Medicana. Not only in Medicana, in terms of Turkey,
Yes.
we have a great experience in hepatobiliary surgery in all over the country.
Excellent.
Not only Medicana Hospital,
Sure,
of course.
sure.
We have great universities in Turkey. We have great private sectors in Turkey who dedicated themselves to help people in hepatobiliary disease.
That's amazing. It's a strong community. So for our viewers, I want to focus more on, so you talked about liver.
Yeah.
There are liver cancers as
Yeah.
well as, benign ones. And
Yeah.
when do you actually need a transplant? I want to focus on that, liver.
Well-
and how many transplants do you do in your facility?
Liver transplantation is the only solution for end-stage liver disease. There are strict indications for liver transplantation. Most of the patients who needs liver transplantation underlying cirrhosis, especially in developing countries like us. Also in advanced countries, their underlying disease mostly cirrhosis. The reason of the cirrhosis is not a problem for liver transplantation. It can be hepatitis or alcoholic cirrhosis or other metabolic disorders. No matter how, if it's end stage, if it doesn't respond to medical therapy anymore, this patient requires a liver transplantation. There are two types of liver transplantation. As you know, one of them is living donor liver transplantation, and the other one is deceased donor transplantation. In Turkey, Turkey is one of the biggest country in the area of liver donor living transplantation. First in Europe, second in all over the world. We have great centers in Turkey. Medicana is one of them, but there are lots of centers in Turkey who dedicated themselves into liver donor transplantation. I am mentioning it because for foreign patients, we can only provide living donor liver transplantation. Deceased donor transplantation is only for our citizens. Every country doing like that.
So when you say living, you mean, for example, you and I, one of us are patient, one of is the donor. We actually are both alive, and we lay down and we give part of our liver.
Yeah.
I give my part of our liver to you, for
Yes.
example.
Simply, if we exclude the children age, I'm not interested in them. In adult age, if you have a liver disease and you have a volunteer as a relative volunteer to give a part of his liver to you or her liver to you, at the same time they come to operation room. In two teams began to start at the same time.
Is it one room or two?
Two separate rooms.
Wow.
Two teams begin to work at the same time at the theater, two different operating room. They take a part of the healthy one's liver. At the same time, simultaneously, the others team are extracting all the liver of the patient.
Wow.
And then the part of the healthy patient's liver came to other room. It's simple to talk, but it's a great complex procedure. And then
timing is very important.
Yeah,
right?
timing and working together is very important. It takes 7 or 8 hours approximately to finish a procedure.
Wow.
But liver disease not only requires the transplantation. Some of them may require other procedures. Also, we perform resections for the liver tumor patients, especially our viewers from the Africa. Cystic fibrosis is a great problem also in Turkey and the countries in Africa. We also making surgeries for these patients, and maybe it can be more helpful to them if they need this kind of surgery. They can come here and we can help them. Also, I would like to tell if the surgeons in there who would like to learn or train this kind of procedures, they can also come to Turkey.
That's
and
amazing.
We can provide teaching to them. To work with them will be an honor with us.
Ladies and gentlemen,
we are ready to help them.
This is amazing invitation from Prof. Dr. Ali Khan Gökhan. If you are a patient or a physician who wants to get some form of shadowing or training, you're welcome. And please call these numbers to have a discussion and how we can help you to get this amazing opportunity in Turkey. Dear Ali, in terms of liver, I understand there is a cancer where you do the cancer tumor. If needed, you do the transplant. It takes a very long time and test. How many days does it take for a patient to be discharged, and how long is the follow-up for the transplant patients?
Well, if everything goes its way, if no complications occurs, patients require 3 days in ICU unit after the operation, 10 days more in the service. After approximately it takes 14 or 15 days to have a discharge, but we don't let them to go their country after that time. We need 10 or 15 days more for follow-up. They have to make their arrangements account to around 1 month for this procedure.
I see.
In terms of
and now for follow-up?
Follow-up takes a life.
Yes.
A life.
So they have to fly in, or at least every 3 months or every 6 months, right?
Well, after the surgery, we want to see the patients at the end of the 3rd month.
Okay.
And then at the 6th month, and then the 1 year, and then after 1 year, once a year.
I see. Then it is more, loose. In
Yeah,
terms
they say they send their test results to us.
Excellent.
We can provide online help to them.
So you have digital online
Yeah.
services now. That's very good.
That's also includes our patients. We don't only make our transplantations, also cancer patients, especially pancreatic cancer or gallbladder cancer or common bile duct cancer. We also go on to follow up when they return to their home.
So a patient in Ghana or Uganda or in Kenya, for example.
Well, we have a surgery, pancreatic surgery next month from Sudan patient.
Really?
Yeah.
Wow. Do they, that's amazing having, my question is like, can they initially call and have an initial online discussion? Do you provide initial
Preoperatively or postoperatively, we can evaluate them.
Okay.
We have a system in our center.
Before the surgery, for
before the
example,
surgery, they
to have an idea.
Yes,
Or
they
a
can-
second opinion.
Yeah, as a second opinion, or to decide to come or not to come.
Yes.
They can send their results to us online. We have a system in there. Our assistant shows us the results of the patient. We evaluate them with our team, and then we declare the results or our opinion to the patients. If they decide to come, we also welcome in Turkey, in our hospital.
Excellent.
We treat them. After the conclusion of the treatment, we also go on to follow up as long as it requires,
Excellent.
according to the severity of the disease.
And they usually require a letter to take a visa, and the letter needs to come from the hospital, so they can actually come in. So that letter is required as well. Yeah.
In terms of foreign patients, we have a department for foreign affairs. They sent an invitation to them to take a visa if the country needs a visa. In that document, we declare that this patient needs
This
that
type of-
surgery. For
I see.
instance, this gentleman or this lady has a pancreatic cancer or
Yes.
gallbladder cancer, and we are planning to perform a surgery in Turkey. We declare them to their government. With that invitation letter, they go to our embassy.
And they get the
When they visa approved, they can come to Turkey. At the border or in our hospital, also we have a test for PCR for every patient for the pandemic. If they are negative, we can go on their treatment. If they are positive, it can be they can be treated in the other centers of
Quarantine,
Yeah,
and then they can come for the treatment.
after the time. I think it requires 14 or 15 days.
And then-
When they become negative, we can go on their treatment.
Excellent. In terms of gallbladder,
Yeah.
because there are many gallbladder stones, but also there are many types of diseases. Can you tell more about the biliary tree and what type of diseases do you usually deal with? Like, do you do ERCP and other types of procedures, and what type of procedures do you typically do?
Well, in gallbladder stones, we call in cholelithiasis in medical
Yes.
terms, but gallbladder stone disease is a very common disease, especially in our country, in advanced country, in anywhere of the world. It's a most common disease, especially in middle-aged women.
Yes.
It can be accepted a middle-aged woman disease.
Was it 40, fertile, female, fair?
For a
fair?
sign, yeah.
I still remember after 20 years.
Yes. We are still learning to
4F.
our students in that way.
4F.
4F signs, 5F signs, male, 40 female.
Fertile.
Fertile, it can be accepted as a middle-aged woman disease. Cholelithiasis is a worldwide problem. It's not a fact that all of them require surgery.
Yes.
I would like to say, if you have cholelithiasis or gallbladder stone disease, that doesn't mean that you have to go under
Surgery
an operation.
immediately,
It's not strict. But if you have symptoms like digestive problems after a great meal,
Yes.
if you have infected your gallbladder before, if you have a diabetes,
Sure.
we offer them surgery.
And they come with pain, right? Many
Yeah,
of them have
mostly they come with pain,
But,
and sometimes if the stones of the gallbladder are very small, it can fall down to the common bile duct. Then they come with icter.
I see.
Yeah,
Then they are yellow.
hyperbilirubin. Yeah, yellow eye, yellow skin.
I see.
Sometimes they come with that complaint. That changed our strategy.
I see.
If he or she comes with yellowish skin, and if the reason is the stone in the common bile duct, and before the surgery we have a ERCP unit, an intervention from the mouth in anesthesia. They make a small window between the duodenum and the common bile duct.
Yes.
They remove the stone. Following 2 days or 3 days, we take the patient from the operating room and perform a laparoscopic cholecystectomy. That's a different approach, especially patients with ICTA.
I see. And that's amazing.
Gallbladder disease in middle age, in adult patients, also can be accepted as a source of cancer in long term. If you don't treat them properly in long term, chronic inflammation is also cause of cancer.
I see.
So these patients should be treated properly.
Intervening at the right time is very important, right? Not to turn to cancer as well. Yeah.
Yes.
That's amazing. So you talked about, liver cancer as well as transplant. You talked about gallbladder stones as well as different types of gallbladder problems. And in terms of hepatobiliary, what type of other diseases do you come across usually in your experience?
Well, especially centers, in centers like ours, in referral centers, in big centers, we come across the patients with pancreatic disease.
Pancreas is very important.
Yes, pancreas is one of our greatest challenge.
What is pancreas? What does pancreas do? Why pancreas is important?
Pancreas is a solid organ in your stomach. It has many jobs to your body. It's not only endocrine gland, it's also an exocrine gland. It provides hormones to your body, like insulin, glucagon. That's the endocrine part of the pancreas, but also it has an exocrine function to digest your food. So there is a great scala in his terms of disability or sickness. There are lots of pancreatic disease, not only malignant one, but also the benign ones, from beginning to simple pancreatitis to advanced pancreatic cancer. But as a hepatobiliary surgeon, we are facing of the patients who require surgery. We perform surgery for the pancreatic cancer. Pancreatic cancer can be found in any part of the pancreas, in the neck of the pancreas, in the head of the pancreas, in the tail of the pancreas. There is a discrimination between the tail of the pancreas and the head of the pancreas because the patients have two different complexes. In the head of the pancreas, patients come with icter, yellow skin, and losing weight, losing appetites, that complete. But in the tail of the pancreas, they usually came with a huge mass in their body because it's a sneaky disease. It doesn't give signs in the early stage of the disease. It's unfortunately we detect in advanced stages of the disease. So it's very hard to deal with them, especially in the tail of the pancreas.
Interesting.
I think I performed more than 300 or 400 of pancreatic cancer patients. It can be accepted a great
surgery.
It's
pancreas.
We have a very popular book. Rest in peace, Schwarz wrote it in general surgery, textbook of the surgery. I think 1 month ago, Schwarz has passed away.
Yes.
In that book, it says pancreatic surgery, especially named Whipple, is the Mercedes of the surgery.
Wow. Mercedes of the surgery.
Mercedes of the
German
surgery.
car.
Yeah,
Mercedes
very popular German car. It wrote like that.
Whipple surgery is the Mercedes of surgery.
Mercedes of the
because
surgery.
It's a very unique surgery, right? But you're connecting to each other. Very complicated.
Well, simply you remove the half of the abdomen and reconnect them. It's a complex procedure. It should be done in experienced hand. It's not a one-man show.
I see.
You need a team, not only for operation, also the follow-up the patient in ICU unit or in the service.
I see.
As a matter of fact, pancreatic disease or other complex procedure in hepatobiliary area one man is nothing. That's a team man.
Absolutely,
You need teammates to help the people. Thank you, God, we have it.
And
Also-
your leadership is also important within the team and bringing them together. I see from your Instagram posts, you are always emphasizing the importance of team
Yeah.
and how much you like your work. So it's so important that you have that synergy. And it also shows your leadership as a
thank you
surgeon,
for your
know,
complete.
that you're bringing them together.
Good teams, good surgery, but being a leader is very important too.
Ali, we're coming to the end of our show. I want to get your last opinion about, in general, what your recommendations are for our viewers around the world, international, because this will be viewed also through YouTube, but also our patients from Africa and our physicians. What are your recommendations? And before closing also, how did the Turkish healthcare system change from 2000 to 2020? What has changed and how did it change?
Well, it's a great pleasure and an honor to be able to say that most of the things changed in last 20 years' time in Turkey, especially in healthcare system. We have lots of healthcare providers in Turkey who are capable of doing everything in terms of surgery, in terms of internal diseases.
Excellent.
The government and the private sector, hand in hand, went too much in the last 20 years.
So they both increase their
Yes.
standards, like
Yes.
flying,
Yes,
like a sky,
it's, not only government, but also the private sector went lots of way in healthcare prevention. We can help patients from everywhere all the world, especially from Africa. We are waiting them. And also, I would like to re-announce that if some physicians, if any physicians in anywhere all the world want to learn something about surgery, we are inviting them.
That's amazing. Dear Ali Khan Gökakın, Professor Dr. Ali Khan Gökakın, we were really honored to have you. It's such a pleasure getting together with my old friend, which is always continue as I call it young and old friend, Thank you for your time.
Thank you.
Ladies and gentlemen, this is the end of our show. I'm really thrilled and excited that I'll be able to bring amazing surgeons like Professor Dr. Ali Khan Gökakın. Feel free to call us through our WhatsApp, send your messages, and always come to Turkey for treatment or for any of your requests, including training, as he, provided the opportunity. This is Dr. Yavuz Selim Sılay, physician, entrepreneur, and venture architect. Stay tuned to NTR. Take care and all the best. Bye.